Over 400 primary healthcare providers across Delta State have been trained by the Delta State Contributory Health Commission in the Commission's bid to ensure better treatment for enrollees of the State Health Insurance Scheme. The Director General and Chief Executive Officer of the Commission, Dr. Isaac Akpoveta, said primary healthcare remained the basis for the healthcare insurance scheme. Dr. Akpoveta, represented by the Director Admin in the Commission, Comrade Bolum Martins Nwachukwu, took time to enlighten the health practitioners on the new policy of the Commission and how they could maximize the benefits for the good of all.
The primary healthcare center is actually the basics for the health scheme. And because of that, they are the most important persons in healthcare provision because all primary healthcare comes from them. The scheme is designed in such a way that primary care is the beginning, is the entry point. So all the enrollees ought to be their own. And if they embrace the scheme properly and do what they ought to do, they will make more money because the business of healthcare is in capitation. The scheme is a serious business for them, that they are the most important people. So they should do everything to take care of our enrollees, treat them well. If I were them, they will have to get new enrollees, make sure that they increase the numbers by treating them well. When you treat an enrollee well the first time, he will always come back. And if you treat somebody who is sick well, the person will not come back in 3 months or more, even the malaria. And then they will make money because money from capitation is paid every month, whether the enrollee comes to the hospital or not. And it's such that if you have 1,000 enrollee, only about 300 or less will come in a month, but every month you get money for 1,000. And so the training is to bring them up to date to their responsibility, and if they want to grow, if they want to make money, they have to embrace the scheme and work towards the welfare of the enrollees. That is their cash point.
Participants thanked the Commission for the training and pledged to use the knowledge gained into good use.
So I learned a lot of things today. I've not come to this training before, my first time of coming. So it has been confusing me, basic beds, yes, one thing, capitation, no, they were confusing me. So now I understand where basic bed is coming from and capitation is coming from.
I'm happy that this kind of a program was organized in this present time because as they told us, they are restructuring and re-evaluating, and I think it's timely enough to tell to everyone in order to see that as we begin this new year, everyone is on the same page, doing what should be done to patients and even doing the necessary things that are needed to be done by the Commission. So I think it's a welcome idea. Well, I want to say, actually, since the Commission started this program, it's been a lift for those who couldn't afford the health care. I know many of them are happy and want to commend the Commission for that. We also say that they should continue and do more.
We had a wonderful day today, and there was step-down training on how to go about the Basic Health Provision Fund, and a lot of training. A sort of skill acquisition and empowerment to help us to know the in-job thing. There's capitation, so these are the source of fund coming in from the Basic Health Provision Fund. It's a pool of funds from the federal to the primary healthcare agency and to the commission, these contributory contributions. So this fund goes through the primary healthcare centers and all different health facilities, secondary and primary care services levels. So this fund goes through for them to render some services to under 5 free and antenatal services free. So it's actually a right direction to help improve the health services. Yeah, it's going to be awesome, very great, because under 5 people, especially for disadvantaged people, it will help them to save money, prevent them from spending, and helping them to channel their other revenue or fund into other avenues, because the government is already helping in this area. So the Commission is doing a very good job. They should keep up the the tempo.
Commission, thank you. God bless you. Please keep it up. We want more of this. From time to time, let's have this seminar rolling. It will help us to upgrade. The new package that's being launched now, I will know how to do our billing, the things to add, the things not to add, so that we'll get our full package of payment. Okay? And it's so educative. Thank God I'm here.
The program I really enjoy. It's exposing. This the basic health is very good because all that they taught us today is really what we need. And even the enrollment will be of help to the state and the people, the community concerned. It's good for us to really have a basic sense of what is really going on, of which they did, and they carried everybody along so that nobody will say, and nobody will be left out. It's very encouraging. In fact, the government is trying, and those in charge of this program are really trying. May God bless us. If we that are implementing it can really put it into practice, it will be of a good help to the states, even to the community that we are working with. In fact, they will be so happy because we are working inside the river, where you pay 10,000. Out 10,000, that is just within the river. For you to come out and go, you spend almost 20-something thousand. Talk less of coming to treat yourself, but giving them this kind of free thing is almost like free. Because if you compare, consider the money you will put in, you know that this one is really beneficial. So it's for us to put our efforts to make it really good.
And then many things for today's training concerning the basic health insurance. So like the aspect of the cash shop side, and learn it very well. They talk about the responsibility when we talk about cash inflow and cash outflow, which I also learned very well. The commission should try more and to also try to visit the health facility they have given this assignment, so that whether they are doing very well. By doing that, I believe that we'll have progress.
Eunice Emeyazia reporting.